All right, I have half an hour, and this is a very shortcut version of our very extensive mandated reporting procedure in service. So we cut it down from 69 slides to about, I think this was like less than 30. So if I'm gonna talk kind of fast, you're just gonna have to go with the flow, and then I'll try to get as many questions answered at the end if you have any. And thank you so much for letting me come out today and being part of the speakers. And it's great that we already had Paul Greenwood. We had Scott already talk about identity theft. So now my role is just to give you an idea what Adult Protective Services does, and basically the different types of investigations we do as well. We partner with so many agencies in the community, and as you know, Paul Greenwood is our prosecutor. We cross-report, we work closely with law enforcement, and it's folks like you, the eyes and the ears in the community, that will need to make the call to APS in order for us to get involved. So the title of this topic is Mandated Reporting of the Elder-Dependent Adult Abuse, because when we have our working hat on, we are mandated reporters. And our agency is part of the County of San Diego Health and Human Services Agency, and our department, AIS, has 30+ programs. And one of the programs we have is APS, Adult Protective Services. Just to quickly recap, you should have with you, and I think a couple of the ladies, Anna and them, already gave it to you. I gave you some information. The salmon-colored sheet is just basically the shortcut version of the slides I'm going to show to you. And at the back of that one, you have some wonderful community resources hotline that we provided. The ivory-colored, thicker bonded paper is the AB40, which is actually what took in effect January 1st of this year. So this is the best handout we could give you with the diagram. We have a more extensive PowerPoint, but that's a little bit more complicated. So I'm giving you the really shortest, sweetest version that we could have. And we've incorporated that as well in this PowerPoint. This only pertains to licensed facility and if there's physical, seriously bodily injury involved. And the newest part of this law that took in effect is that law enforcement agency needs to be notified, okay? And at the back of that gives you the actual definition of serious bodily injury as well. And the last thing is just a nice little brochure holder that has some of our key brochures that we ought to give and share with our providers and folks when we do this type of trainings. You should have our bookmark, our magnet, which of course you've heard the number, 1-800-510-2020. Our network of care website is also included in all the brochures. You should have at least 3 major brochures in there: the programs brochure, protection and advocacy is the main part that I will focus on today, and then project care, okay? I'm gonna go ahead and start with the slide, and if this is kind of redundant or repetitive, it's just basically we're just trying to give the overall idea of population that we serve. In California, 65 and over, you are considered senior citizen, whether you like it or not. We have our baby boomers who do not want to be called senior citizen. We tell them mature adults, active adults, whatever you want. But for the sake of my presentation, I'm going to refer to everyone as senior if you're 65 and over. And then we also have jurisdiction over folks that are not quite senior citizens yet, but they fall in this category and in this age grouping, which is the 18 to 64 years of age. And then they have a physical, mental disability. And also it may depend where their residence is as well, okay? So when you really think about it, AIS, our agency in general, is the department that serves older adults and disabled adults. 18 and over really falls under our jurisdiction, okay? With CPS, as you know, Child Protective Services under Child Welfare Services, they're dealing with the minors. So it's their jurisdiction to go ahead and investigate suspected abuse when it comes to minors that are up to 17. Once they turn over to 18 and over, they are adults, so that goes under our jurisdiction. And as mandated reporters, it's important for us to know that we have a legal responsibility to make the report. Especially when we have our working hat on, you need to remember this. Even on a volunteer capacity, we need to emphasize that part of it. We have some volunteer groups sometimes get confused if they are mandated reporters or not. The bottom line is, if you're providing direct, indirect services, even on a paid or non-paid capacity, you're dealing with this population. When you suspect abuse, and we'll go over some of the different types of abuse, you are legally responsible to make that report, even on a volunteer capacity, okay? Sometimes for the agency or company you volunteer for, they may have a certain protocol or policy, which we say, go ahead and go with that policy, but at any given time, you can make that report, and no one has to tell you you cannot make that report, because it is your legal responsibility, okay? And as mandated reporters, there's a lot of things that we need to make sure we follow. There's a protocol in reporting, and I want to make sure, I think part of the slide will show you the actual form. It's a two-step process, and I just want to get through some of the slides right now, and then we'll try to make this flow, because we had to cut a lot of different slides in here to make it fit for this very short 30-minute presentation. And this one right here, basically, if you have knowledge, you witness it, you suspect it, or the bottom line is you have your gut instincts telling you something's wrong, warning signs, red flags, you ought to go ahead and make that report to our 800-510-2020. We know it's never black and white. There's a lot of, I'm not really sure if this is abuse. We do not want you to kind of second guess and say, well, you know what, I don't think there's abuse. What happens if there was abuse, investigation goes through, and then we realize you were involved with that situation with that person, and you failed to report? There are consequences, and we'll go over that. So what we want you to do is be comfortable and call our APS hotline, which is available 24/7. You could get someone in there to take the referral. And you need to make sure you give the information of the victim, where they live, what's the situation, to even know who the perpetrator is. They will make the determination if there's abuse or not. If you have enough, then they'll say that, yes, this is an appropriate APS referral. If not, they'll tell you what else they need to make sure it could get elevated to APS. It could be very possible where you think it might be an APS referral, but due to the situation you described, the person might have more mental health issues going on. They meet the criteria of 60 and over. This could be the senior team mental health outreach team that actually could go out first. So again, you provide as much information to our hotline, let the social worker make the determination, and then they could go ahead and tell you exactly which program, which service is available for them. And now we're going to get to all of the different types of abuse that APS investigates. And again, I'm not going to go every single one of them. You've gotten a lot of information about financial abuse. That itself could be a whole day of presentation. We'll never have enough time to go over the different types of financial abuse that's going on. The Welfare Institution Code numbers up there basically tells you, it identifies which kind of abuse we're dealing with. In some cases, it's not just one. It could be several of them. A lot of our cases, though, have financial abuse. They're companion case for a lot of our cases. And I know Paul already said a lot of the physical abuse. You saw a lot of pictures. I have pictures too, but with this 30-minute thing, I figure I'm going to have to skip them. But you get the idea of the different types of abuse that we actually have to investigate. Physical abuse, there's so many different categories on that. Domestic violence, sexual abuse. Let's not forget, we are also dealing with the dependent adult category. It's very common that it could be a disabled child. They're in their 20s, but they have the functioning level of less than of a 2-year-old. Dad is sexually abusing the daughter. Mom could possibly be aware of this, not doing or saying anything. So these are some of the cases that we've gone out to. Or it could be a disabled adult child. 2 other kids are normal, the other one has a mental capacity of, again, a toddler, and they refuse to get other services or take them to a different facility because guess what? They're getting the check. They're the rep payee. So there's always that, again, what is in it for them? So it's really important for us to make sure we get there, we do the investigation, we assess for vulnerability, and we have to recommend the best services because APS is a short-term crisis case management. We are getting cases every day. We have a very high caseload right now. You could imagine, if you haven't heard, 2009, we did get some cuts. APS was cut 10%, and Ombudsman, which is the program that deals with the residents in a licensed facility, they were cut by 70%. It's a huge cut. The good news is we're now able to hire more APS workers. And back in the day, they're averaging 18 clients in their caseload. Those days are gone. We have at least have a lot of cases. Active cases are anywhere from 20 to 30, up to a point it could be close to 40. So they're trying to open cases, close cases, and the main thing is we work on an MDT approach, multidisciplinary team approach. And you could just imagine one case could be several agencies working with that one particular case. I want to also make sure you know that there's a lot of other types of abuse that are listed here. Mental suffering, those are the harder cases to prove, and it becomes a he said, she said type of thing. We need more evidence, but Paul Greenwood has tried cases before with mental suffering. Self-neglect, we will spend a little bit of time on that because, again, as mandated reporters, you need to understand self-neglect is not against the law, but if you know someone is self-neglecting, you ought to report that to us anyways because you never know, out of that phone call, we're able to start that person with a small service. There are two types of self-neglect clients anyways. The gravely disabled folks who are easier to help because they realize they need the service and they need other folks to step in. But who's the other part of that equation? The self-determined, it's my life, you can't tell me what to do, because again, they can refuse our services. And I know I was talking to, I'm sorry, I forgot your name. Frank earlier. With the self-determination in place, they can refuse our services. They can go ahead and say, guess what? This is how I want to live my life. It's usually our pack rat hoarder. You could tell it's the neighborhood eyesore anyways when you're going to this house, right? And just the way their lifestyle is, it pretty much presents it. It will take an average 8 to 9 APS referrals or visits from probably the entire unit knows this person before they will probably say yes to a small service. So it doesn't mean you referred it once, nothing happened, refer it again, because just like Paul said, we have a historical data. When people are getting referred, we could know exactly how many times this person's been referred to our hotline. And there might be some changes along the way. Let's say earlier this year, the person is just a very self-determined person and they're pretty competent and they just want to live this way. Later on this year, you're noticing some cognitive impairment. So now we could say, well, maybe this person needs a mental health evaluation. So we could get other folks to step in and help out, okay? Self-neglect, again, it's not against the law, but it's really important for us to get in there because there's so many folks out in our community that are self-neglecting. Some of them, they're just on limited resources. Some of them, they're just very isolated, or they just don't know a lot of the resources or available services out there. And they may need someone else to advocate for them. Just like Scott said earlier, everyone in this room could be an advocate for anyone, especially with the population we're dealing with today. With the high unemployment rate, our economy, of course, we're trying to recover. Who do you think they're going to prey on at this point? It's going to be the elderly disabled because they know they have some kind of a retirement, pension, income coming in, and some folks know that they like to keep some of their money, cash, in their home. So they're trying to make sure they're going to use because of their vulnerability, they have a disability. Some of them lost their spouses or they're pretty much on their own. They're going to take advantage of that so they can go ahead and go in there and try to be their friend. Next thing you know, they're taking over. Everyone else they deny any kind of contact. And I know there's a lot of fiduciary in the audience today, so if you're gonna notice a lot of these red flags, you ought to go ahead and get a referral to us right away so we could get the investigation going. And you have that unique relationship with the client anyways. You know what's going on in their financial situation. There's always things that always stand out that you feel like, this doesn't sound right. And there's so many scams going on, internet gambling. I was just in San Francisco at the Elder Abuse Conference, and the numbers are just really high right now, what expected for folks to be more victimized on elder abuse, especially those who are in need of caregiving services. At the end, hopefully I'll give you some statistics on the last fiscal year and the current fiscal year we're in right now and how many referrals we're getting in our hotline, and a quick breakdown of that, just so you could get an idea what we're dealing with on an annual basis. And other indicators of self-neglect, we're looking for, when APS gets involved, there's always a protective issue. We're looking for basic needs, food, shelter, clothing. And again, if the person has a caregiver or needs more help, assistance, they should have proper food, nutrition. If it's cold or hot, depending where they live, they should have the right cooling, heating system, proper clothing, getting the right amount of medications, and going to their doctors on a regular basis. Any of this, again, is not present, and then the person's taking advantage. They're getting paid to do this service, and then this person, all of a sudden, you're noticing they're malnourished, they're dehydrated. I think one of our high case profile not too long ago is the World War II veteran in East County. And the perpetrator abuser there is the longtime caregiver. And we don't have very many World War II veterans alive, and this person died in such, when we found him, we're surprised that he was even alive. He was severely dehydrated and malnourished. He was in the hospital for a few days, but he died. But we were able to go ahead. Again, it's a whole collaborative effort by different agencies. We were able to prosecute the abuser, which is the caregiver. And the good news is she's never going to get out. I mean, she has a long, long time to serve. So she's going to be in there. And the main thing is for us to know that she can't victimize any more people, because we have been able to take her out of the system, and now she's in a different system that she could go ahead and stay there forever. We're always also looking for their mental capacity. Are they oriented to person, place, or time? The self-determined one, I'm telling you, it's really hard, because CPS have more enforcement powers because they're dealing with minors. But when you turn over to the adult population, it's on a mother may I mode. We have to ask for permission. These are adults. They can refuse our services. So I know a lot of times some of our reporters get frustrated. I made that referral to APS. APS didn't do anything. Please keep in mind the self-determination, but always call the 800 number if you feel like you just got to really advocate and push for it, and keep referring it to us, because we have a 10-day time frame to respond to the referrals depending on the severity of it. And look at the time, oh my goodness, and I don't even know what slide we're in. We can't do much, but there are a couple of exceptions. If the person is mentally incompetent, at the same time they're a threat to self or others, then we can pull in other folks to step in and assist us. If they meet the criteria, let's say senior team, they only have to be 60 and over, they could do the mental health evaluation. Again, they have the criteria. If they meet it, they could do a 5150 on them, which is a psych hold, okay? That program was cut as well, so instead of 6 staff, we only have 3 licensed mental health clinicians serving the county and only certain parts of the county. The other parts of the county will be referred to geriatric mental health clinicians that are contracted through us. So we had to let go of our psych nurses, the 3 psych nurses. So it's really sad, but you know, someone else will be able to go ahead and see them if it's not senior team. We went over this, trying to be mindful of the time. And what other folks and programs we work closely with? Well, public guardian, public conservator, and public administrator now is back under AIS. They were for a while a separate entity, but now they're under our umbrella in our agency. Senior team and mental health geriatric specialists, I mentioned to you, they have to qualify, and the criteria for that is 60 and over, and they have to have a mental health issue. PERT team is psychiatric emergency response team. YANA, which is one of our wonderful project care component. YANA stands for You Are Not Alone, and this is our wonderful senior volunteer that will do face-to-face visit. We get a lot of referrals from them as well because they do know what's going on in the older adults' home. Code enforcement, animal control, Humane Society, I think you all know our hoarders. They have out-of-control animals, cats, dogs, you name it. We have contracted services like elder law and advocacy and other community partners and resources like senior centers, home-delivered meals, and homemaker agencies. We want you to make sure you report. Do I have less than 5 minutes? Okay. We want to make sure you report to us immediately, as soon as possible. We recommend within 24 hours. This number is the one number we want you to make sure you have handy, but it's also available Monday through Friday, 8:30 to 5 for information and assistance, and to also get into all of our other programs. Everything's done by intake over this phone. Let me go over the quick procedures for your mandated reporting procedure. You have to make the verbal report as soon as possible, but the written report needs to be done within 2 working days. The latest update on that, and I think you ought to know this part if you haven't heard, we have a web referral coming up online for APS. And basically, it's in the testing phase. We're working on the glitches, so hopefully, I'd like to tell you, hopefully this summer. We said spring, and you know, the glitches are still there, so summer, I'm hoping really by fall. But basically, the web referral is making it easier for you to go online. There's a caveat. If it's imminent and you need someone to respond right away, you still have to call it in. The online referral system is for your convenience, but it's not like someone's there waiting in front of the inbox looking for it. So you always, what's in place is still there, the same. But the web referral is just to make it easier for folks to make the report. And let's see, I already said that, effective summer 2013. Long-term care ombudsman is their jurisdiction when the person is residing in a licensed facility. I'm going to have to go pretty quick on this because I'm running out of time. This is the AB 40 long-term care facility, the new law that took in effect, which at least you have the handout on that, pertaining to serious bodily injury, physical abuse. And you will see the diagrams in front of that handout, how one, you have only a 2-hour time frame to make that report to law enforcement agency as well with the other folks. And there's different types of facilities we're referring to here. I just listed them real quick. And as mandated reporters, we will never provide any of your information to anyone. Everything is held in confidence, is the law. And it's up to you. You don't have to tell them that you're going to make a report. Or you don't even have to, when they ask you if they think it's you, sometimes they know it's you. You don't have to say it's me. You could just deny it. Just let us do the investigation, and we want to make sure that you feel comfortable referring it to us. Okay? And you're protected by the Welfare Institution Code. You will not, even as false reporting, we know you're just doing your due diligence. You will not, we will not be, basically what you're doing is trying to give a legal, your legal responsibility in reporting. And so there will not be criminal and civil litigation because of your report. We know that you're trying to do your best to make the report because you're concerned about that individual. Here's the penalty portion of it, the consequences. You fail to report, and it could result in great bodily harm, injury, or death. You can be fined anywhere from $1,000 to $5,000 per incident. If you have a license, it can get suspended, and you could also spend some time in the county jail for up to a year. So that's why this type of training is important for you to know what happens, what are the consequences. But if you're not working anymore, it's after hours, you could always do anonymous reporting to us, and that's what you call the permissive reporter. I never take my mandated hat reporter on. I just keep it because I just don't mind giving my information. But basically, we have folks that can just go ahead and do that anonymous reporting. And this is just the magnified version of the SOC 341, which is the written report. You've seen this. It's triplicate. It comes from Sacramento. You can also fax it to us if you do not want to mail it, but make sure it gets done within 2 working days. Unfortunately, I don't have a lot of this for the big group we have today, but if you Google this and type in SOC 341, again, SOC 341 is the actual reporting form. You could make extra copies because you want to turn in the original to us by mail or fax, and you could always get that information from our call center staff. And then you keep one for your records. And if you feel like the person who took your call said, I don't think you have enough, you feel like you need to advocate more and push it to the next level, ask for the supervisor at the call center. And then they could try to see if they could elevate the referral. And that's just my contact information, and I will end it by just giving you some quick statistics. So as you know, we're a government entity, so we go on a fiscal year. So from the fiscal year July 2011 and June 2012, total APS referrals calls we received for that particular fiscal year is 12,655. The breakdown on that is 10,446 were assigned to investigate. 2,200 referrals were similar or same allegations. So now you know what I mean by we get a lot of them repeatedly. And to see what's going on now in the first half of the fiscal year, I do not have the stats yet. We're ending the fiscal year, but for July 2012 to December 2012, so far we have 5,828 APS referrals, and 5,422 were assigned to investigate. A lot of them have financial abuse cases too. So I'd like to end it with those numbers just to let you know, please keep reporting to us, because when we get involved, we're looking for risk factors and making sure that we get the perpetrator, and we'll work with law enforcement and the DA to make sure we prosecute them. So thank you so much.
Thank you.
Any quick questions, 1 or 2 questions you may have? Yes?
Is there a way to follow up to see what happened?
With
the call is made?
the question is there a way to follow up with a referral? You can always provide additional information and call and say, I just want to make sure if I can get a little bit of information. We cannot disclose the entire case to you. We could give you limited information, and each APS worker have their own style and personality, and they may or may not get back to you. But basically, a lot of them will call you and at least tell you that they are working on the case, and only certain entities are privy to the information. But you could always say, I'd like to add more to my referral, and we'll just take it in and provide that to the assigned caseworker. Great question. Any other questions? Yes?
If a client tells you they have a social worker, could we assume that that social worker is taking care of a situation?
The question is, I keep forgetting we're getting recorded. If they have an assigned social worker, is it okay to assume that they're taking care of the situation? Not necessarily, because you don't know what kind of social worker, case management that person is. So the best thing is you could always find out what's the role of the social worker, what agency, they represent, and you could just say, you know what, you could go ahead and talk to them if they give you permission. If not, you could just say, this is the social worker assigned to this person, and maybe the APS investigator could also get additional information. So call it into our 800 number. Any collateral contacts, you could always provide it when you're reporting it to us. I think that's it. And again, thank you. And please visit my table outside if you haven't had a chance. I will be breaking down my table after the last afternoon break. So thanks again for having me come out today.
Thank you. Thank you. Here's a little gift card.
Oh, thank you.
Your side table partner.